Hi, I'm Bruce Eimer, and I'm here to talk to you today briefly about my pain hypnotherapy level 1 certificate workshop that I will be teaching in Las Vegas at HypnoThoughts Live 2019 this coming August. This workshop is a 2-day intensive workshop that is intended for people who are qualified therapists like licensed psychologists, licensed clinical social workers, licensed clinical mental health counselors, psychiatrists, professional hypnotherapists. And the focus of this workshop is on the ethics of offering hypnosis for pain relief. Now, this is really, really important because there's a lot of different types of people out there offering to take your pain away. Pain management, pain relief is a multi-billion-dollar business in this country. And there are charlatans out there that'll gladly take your money, and some of the things that you might do to get pain relief if you suffer from chronic persistent pain might be relatively harmless, and other things that you might do could have significant risks associated with getting those particular treatments. And of course, there's also the risk of suffering with chronic pain and going to somebody with the hope that they're going to help you and getting your hopes dashed because you were misled or you misunderstood what was told to you in the beginning. And unfortunately, having worked in a pain clinic for over 8 years and having specialized in pain psychology since 1990, I've seen thousands of patients who have been from doctor to doctor and have gotten very disillusioned and alienated because in some cases they were sold a bill of goods, in other cases they wanted to believe something that just wasn't so, and they just didn't stop continuing to try to find something that would help them get out of pain. And nobody ever really helped them to understand the complexity of chronic pain syndrome and ways to manage it and have less pain as opposed to have no pain at all. So ethics, which has a lot to do with being honest and doing the right thing, and transparency, and working for the benefit of your patients and clients rather than for personal gain, that is very important when it comes to pain management. So in this 2-day workshop, we're going to cover quite a bit of material. We're going to start out by talking about the nature of acute pain and chronic pain and pain mechanisms and pain psychology and pain neurophysiology. We're not going to spend too much time with that because we're going to move on to the importance of how we frame what we do as mental health professionals, as hypnotherapists. We're going to talk about the importance, in fact, the paramount importance of being honest and not making exaggerated claims. We're going to talk about the importance of getting informed consent from your client and the nature of informed consent and what should be in an informed consent agreement, what you should tell your client and what they should read and you should make sure that they understand. Then we're going to talk about hypnosis, of course, because the workshop is on hypnotherapy for pain or pain hypnotherapy. And what we'll be talking about are the risks and the benefits of using hypnosis for pain control. Everything has risks associated with it, and as with anything else, we need to balance risks versus benefits. And in the case of using hypnosis, in most situations, if you do an appropriate initial evaluation, the benefits way outweigh any kinds of risks. But you need to be aware of what the risks are, and you need to be able to present those in an informed consent exposition to your clients. Then we're going to talk about what we can reasonably expect to accomplish as hypnotherapists in utilizing hypnosis and other psychological methods to help someone gain lasting pain relief. And we're also going to be talking about the things that we're unlikely to be able to accomplish, so that we need to dispel any notions that clients might have that we can help them get rid of all of their pain or accomplish some of these things that they might have heard that somebody who does hypnosis might be able to help them do, when in fact it's not possible in this world. We'll be talking about what we should and what we shouldn't do, okay? And essentially here, we'll be talking about ways to avoid not making exaggerated claims, ways of being, how to be honest about your successes and your experience in helping people that have chronic pain, and the things that we should avoid doing insofar as things that you don't want to say to someone that you're working with when they're highly suggestible and easily influenced because they're in a suggestible state of hypnosis, and often a highly emotional state. And we'll be talking about things we shouldn't say, things we shouldn't do, and so forth. And we're going to then cover in the first day the intake evaluation, so that whether you're a professional hypnotherapist, whether you're a psychologist, social worker, any type of therapist, and you're going to use hypnotic techniques in order to help somebody to get out of pain, we'll talk about how to begin, how to frame the session, and how to develop rapport rapidly with your client, because if there's no rapport, then there's no therapy. And I love to add in at this point when I'm teaching that essentially hypnosis is a confidence game, so that if you're not confident in what you do, then the client won't be confident in you. And if there's no confidence, then there's no game. So we're going to talk about how to frame pain hypnotherapy. I tell clients that I work rapidly so that you can find out if you're going to get pain relief soon enough. And I tell them that I practice rapid hypnoanalysis, which means I use hypnosis to psychologically analyze what you will have to change to get better pain relief. Not to get rid of all pain, but to get better pain relief. In this workshop, especially at second part of day one and throughout day two, we will cover different hypnotic methods and techniques to utilize with clients, and how to fit the right methods to your client. Okay, that's very important. That requires also doing an appropriate conceptualization of your client, and then putting together a hypnotherapy treatment plan, a pain hypnotherapy treatment plan. Now, one of the things that I didn't mention, and I want to mention that's very important, is that we understand that as hypnotherapists, as psychologists, social workers, and so forth, as therapists, we don't treat pain. What we do is we treat people. And what we target is we target the emotional overlay to their chronic pain, and that is the suffering component. And of course, we're going to address the sensory and physical aspects of pain, the behavioral aspects of pain, and we're going to address the physiological aspects of pain from the standpoint of what's healthy and hygiene and lifestyle and so forth. Of course, we're also going to address the psychological components, which are the emotional components, the cognitive components, the spiritual and the interpersonal components. And this course will also cover the importance of effectively communicating with referral sources, making referrals when that's appropriate, and concluding the treatment. Well, I hope that you will join me for Pain Hypnotherapy Level 1 Certificate this August in Las Vegas, Nevada at HypnoThoughts Live 2019. Thank you for listening, and take care.